Hi guys, welcome to my channel. My name is Keneiloe Myoli, and if you're here for the first time, welcome. I hope that you will like it, share, and will consider subscribing with the red button down below to become part of my growing beautiful family. And if you're a returning subscriber, thank you so much for your continued support. I appreciate you. So today we have a special guest. I'm gonna let her introduce herself. But I did ask you guys to post some questions for her on the community post. I'm sure some of you will see it late, but it's okay. If you have additional questions, maybe ask in the comment section. When she has time, maybe she'll respond. Yeah. Okay, so her name is Hlalis, and she'll tell you the rest.
Okay, hi guys. I like to call myself Nurse Hlalis.
Okay, she's Nurse
Because
Hlalis.
I think it's easier for people. But
Really?
anyways, yeah.
Why?
I don't know. I think some other people struggle to pronounce my name.
Really?
And then they butcher it and they like.
Yeah, I used to call you Nurse Hlalis until I discovered you, Michelle. I'm like, oh, okay, no, now you're on first name.
Yeah.
Okay, yes.
Yeah, so yeah, that Nurse Hlalis is a YouTube thing, so I mean, yeah. Anyways, I am a registered nurse and midwife, but I really like the midwife part of it. So the other part, I don't like it. I relate more to the midwife side of it. Yeah, so I'm a midwife. I'm also a YouTuber. Well, I don't know if I qualify to call myself a YouTuber.
Why not? You do.
But yeah, okay. I'm
she
on
is,
YouTube.
Guys.
Yes,
Yeah.
I'm on YouTube, guys. I do a lot of health content, especially that's relating to women's health. Obviously, because I'm a midwife and midwives work with women. So yeah, that's what I do. I work with women. I work with pregnant women. Yeah, what else?
Your wife. Did you mention that?
No, I didn't. I'm a wife, guys, but I don't have any kids. Don't ask me if I have kids. I don't. But I learn from other women's experiences.
Okay.
Like Keneiloe, so yeah. But yeah, I'm not a mom yet.
Yet, okay.
Yeah.
I like that you're saying yet. Because you know, like sometimes you want to ask, like, do you want kids? Because I feel like some questions are too personal. You don't want to, like, because people have boundaries.
Yeah, hey, definitely. And that's a big thing. But I really don't mind. I don't have kids yet because we haven't planned to have a child yet. Yeah.
Because I also, like, I remember for the longest time, we were not even thinking of kids. And people assumed other things. And I'm like, who said we're trying?
You just didn't plan.
Yeah, I wasn't like, we told ourselves, like, we're not going to have kids for the first this many years.
Yeah.
And then people were already thinking that these people can't have or they don't want. And also, I didn't feel like explaining myself. Especially if someone, I think especially if someone already has an idea, then I don't feel like explaining. If you think that I don't want or I can't have, then it's fine. But if you just genuinely just ask, then I would respond. But also I feel like if you ask in a group setting,
it's a difficult question to ask. I think it's better, Angie, in this day and age to not ask, because you never know. Maybe someone has had multiple miscarriages and they really want to have a kid.
Yeah.
So I think it's better not to ask unless someone, you know, openly tells you about it themselves.
Yes,
then,
yes, true.
You depend on my weakness, satisfying you when I keep bleeding. I don't know why you act like you innocent. You wanna take a piece of my heart again. I get you out.
Okay, let's start with the questions. There's a couple of them.
Okay. I wonder what this
There's a couple
about.
of them. They're nice. My people are nice.
Yeah.
Okay, so the first one is what is a midwife? I think. Okay, what is a midwife?
You know, you can tell us what you think.
No. Okay, this is my question. The question is coming from me. I want to know what's the difference between a midwife and a nurse. Like, do you have to do additional studying, like, or maybe if you are a qualified nurse, but you now work in the maternity ward, does that now also make you a midwife?
Okay.
That's where it comes from.
Yeah. So basically, the word midwife, it comes from with women, right? With women, basically that. So midwives work with women.
Okay.
So midwives can work with women in a gynae setting, where it's maybe at a hospital and it's a gynae ward, and that nurse is practicing primarily as a midwife because they are dealing with women and women's health issues. So you in that ward, you'd find it's people maybe who have like fibroids, endometriosis. Those are the people that are in that specific ward. But you don't necessarily have to be a midwife to work in a gynae ward. But midwife, it relates more to... Midwives are also nurses, but they work with women, more especially in pregnancy.
Okay.
So taking care of women throughout the pregnancy, at birth. So midwives help women to give birth. And then also post-birth, in the postnatal period, which is from birth up until 6 weeks after giving birth. Yeah. So yeah, midwives are mostly known for birthing women, right? And this is natural birth.
Okay.
Yes. So midwives don't do cesarean sections. Yeah. So it's mostly natural birth. Well, it is the only one, natural birth. And midwives, they work with gynaes.
Yes.
So, but I think we might delve into that later on. Yeah, but midwives do work with gynaes. They can work independently alone. And then it depends on the setting, really.
Yes.
Depends on the setting, whether it's in private, whether it's also in the clinic setting or it's in the hospital setting. In the clinic setting, usually midwives, they will work alone. They can work alone.
Yes.
Like if you go to a government clinic and you're pregnant, it's a midwife that will be taking care of you throughout the pregnancy. And you'll probably, the only time you'll probably meet a gynae, if you're in the public sector, is if there is a complication or there's a condition that you develop during the pregnancy. Then that's the time where you actually have to be with a gynae at some point. But if you're having a low risk pregnancy, meaning that you don't have any medical conditions, you don't have any previous surgical operations, then you can be with a midwife throughout your pregnancy, and at your birth it can just be the midwife who's there with you, deliver your baby, and even after post-birth. Yeah. So yeah, basically that's what a midwife is. And then the question that you asked now, how do people become midwives? So as I said, midwives are also nurses. So previously there was a diploma and a degree, right, to study nursing. Yeah. So you either did a 4-year degree at the university or a 3-year diploma at a nursing college. And then you become a registered nurse and midwife, and you're a community nurse as well. So the nurses that when you go to the local clinic, you find them there and they give you your hypertensive medication or diabetes medication. So yeah, they have community nursing that they did as part of their 4-year program. And then also when you go to the mental health institutions, that's where you'll find psychiatric nurses. But you don't specialize. So you learn all of the different areas: community nursing, psychiatric, general nursing, which are the nurses that you will find in your hospitals, in your surgical wards. For example, let's say you get into an accident, so you'll see a casualty nurse.
Yes.
Or if you're admitted for diabetes or hypertension or whatever, then you'll be in the medical ward. So you won't find midwives there.
Okay. Yes.
So midwives are the ones that deal with the babies, because now a nursemaid that works in the surgical ward, they might not they would have done it in their training if it's the course that was before. Was it 2020? Because there's a new curriculum now, and it does things differently. But previously, with the old curriculum, a nurse who's worked in the medical ward all their life, if you put them in a maternity ward where they have to deliver babies now, that's like, oh, okay. Yeah. So, but now there's a new curriculum whereby you do general nursing for 3 years, and then in the last year or the last 2 years, that's when you choose your specialty. So you choose whether you want to go the midwife route, or you want to go the community nursing route, or you want the psychiatric one. So now with the new curriculum, you're not going to do everything. Yes.
So let's say you started with the midwife, but now you want to do community, you have to go do the additional year again. Oh, that's interesting.
Yeah.
Okay, that makes sense.
Yes.
That makes sense.
So, and now also with the new curriculum, you can only do it at a university, not, and it's a degree and not a diploma anymore. Yeah. Unless you're just going to do general nursing, which is the nurses that you see at the medical wards. And then with that one, then I think you can do the 4-year or 3-year diploma, but then you're just going to be a staff nurse. You're not going to be a registered nurse.
That's interesting. My grandmother was a nurse.
Oh, nice.
I don't know if she worked in different departments, but she worked. She was in casualty.
Okay. Yeah.
Yeah, but it's a small hospital called Tabanchu. Moroka Hospital. It's in Tabanchu. Yeah, it's
close to Bloem.
Close to Bloem. It's like Pretoria and Joburg.
Oh,
yeah. So you could stay in Bloem. I think it's like a 45 minutes to an hour drive. Yeah. But for us, it's far. But if you stay in Gauteng, it feels like it's close.
Yeah.
Okay, that makes sense. I think I'm gonna have. I think maybe towards the end, because I structured my questions, it sort of limits me, but I think towards the end, I'll just ask you as a whole.
Okay, yeah. That's fine.
Okay, the second question is, you did answer, how does one become a midwife? No? And then the third question is, what's the difference between a gynae and a midwife? Guys, I'm reading questions from my phone, so.
Okay, gynae and midwife.
Yes.
So obviously a gynae is a doctor. So a gynae, okay, I won't be sure of the specifics, but what I know, so a gynae will study medicine, right, for 6 years.
Yes.
And then they'll have to go through that whole route of being an intern. I think it's 2 years. And then after being an intern, do community service, which is 1 year. So that's 6, 7, 8, right? And then they're going to become a medical officer. So when they get to the medical officer, which is, I think, in the 9th year, I think that's when they can specialize. The doctors can correct me in the comment section. But then they specialize now and become a gynae.
Yeah.
So, you can become a physician when you are a doctor, which is the one that deals with things like your diabetes, all your normal general illnesses, kidney disease, all those things. Then, or you can now specialize. Oh my gosh, I hope that thing is not too long.
It's fine.
Okay. So, then now other doctors will specialize in obstetrics and gynae.
Yes.
So the obstetrics part is the one that's the baby pregnancy, then the gynae is the gynae part. So a gynae has worked a lot more years than a midwife, if I can say. But the important thing is that gynaes are trained to deal with complicated cases of pregnancy. Okay. So, with the gynaes, they specialize a lot, or they're trained more to deal with abnormal pregnancies. And abnormal meaning that there are complications or medical conditions.
Okay.
Right, like if you have high blood pressure in pregnancy, if you have diabetes in pregnancy, or if you need a cesarean section in an emergency, then the gynae can come in. Not to say that they cannot be with the women if the woman is having a low risk pregnancy where they have no medical conditions and everything is fine, because some other people choose to have a gynae even if they're having a normal pregnancy. Especially in private, you can choose. But in the government sector, you will usually be with a midwife if you are low risk. And then if maybe at some point in the pregnancy, maybe you develop high blood pressure, for example, then you'll be referred to the hospital where the gynae now will be taking care of you. Okay. Then when you give birth at the hospital, the midwife will be the one who's there with you in maternity to help you give birth. If everything is still fine and your blood pressure is well controlled. But in the event that maybe your blood pressure becomes uncontrolled, then you'll have to go for an emergency cesarean section. Then the gynae will be the one doing that for you. So that's why I said in the beginning, midwives and gynaes, like, they work together, also depending on where you are. In the private sector, you can have a gynae as your primary care provider throughout the pregnancy. But when you go to the maternity ward to give birth, when you're in labor, the midwife will be the one who's with you. So the gynae will just come in and check and then see, okay, how far dilated?
I've heard that.
And,
Yeah, okay.
And then maybe he will decide, oh, I want to rupture the membranes or whatever. But the midwife will be the one who's constantly taking care of you throughout the whole time. Yeah.
Okay, that's interesting.
And then also, midwives can also specialize. So you can just be a normal midwife, or you can be an advanced midwife. So, or midwife specialist. So then you have to do an additional qualification. And then, so with if you just have the 4-year degree, the curriculum focuses a lot on like normal pregnancy and labor, when events are happening normally. So yes, you will also learn about when things go outside of the normal, but when you do advanced midwifery, then you're going to focus a lot on when things go outside of the normal. Okay, because in some instances the midwife has to stabilize the patient if there's something that goes wrong. Labor is going on longer than it's supposed to be, or baby's shoulders are stuck when baby's getting born, a condition called shoulder dystocia. When maybe baby's too big and baby's like the head is born and the shoulders are stuck, then midwives need to be able to manage that condition.
Okay.
Yeah, and then maybe the gynae will be involved once the woman or the baby has been stabilized, because there'll be instances as well where baby needs to be resuscitated. So in the advanced midwife course, they focus a lot on those instances where things go wrong, because the midwife needs to also know how to stabilize, to notice when something's going wrong. But even if you haven't done advanced midwifery, you still learn all of that, because also when you are in the hospital, you also learn, right, the practice part of things. So there's a theory and a practice part of things where you learn a lot. Yeah. So yeah, those are the differences. But just in simple terms, mostly the gynae is for when the case is complicated, and the midwife, if you're having a normal pregnancy, there's no issues, no complications, then you can have a midwife throughout the pregnancy, at the birth and everything.
Okay.
Yeah.
There's a question that I wanted to ask now. Okay, so let's say I fall pregnant. Is it fine for me to say I want both a gynae and a midwife? Is there a need for a doula also?
A doula, yes. So a doula is a labor support person that's going to be there when you give birth in labor. But doulas also, in some instances, are in the pregnancy just before you give birth, because they're mostly involved in the birth and the labor more especially.
Yes. I've seen like when they have those bathtub, what is it called?
A water birth.
Water birth. I see the doula will be inside and like telling you to breathe.
Yeah. Or like, I think, mostly outside. They'll be around. So the mom will be the one that's in the bath, and then the midwife will be outside. Yeah, if the dad wants to. Yeah. Then the midwife will be outside. The doula will be outside. So the midwife will be monitoring the labor. Is everything going well? Okay. Is mom and baby still fine? Is the labor progressing the way that it should? Then the doula will be there to help the mom emotionally and also physically, in terms of, because there are certain exercises that the mom can do to help the baby's head go down, things that help to progress the labor. So the doula will be there taking walks with the mom, helping the mom to squat, to bounce on the ball. All of those things are things that help with the pain and also help with relaxation and the progress of the labor. So yeah, that's the doula. So the doulas work with midwives a lot, because now the midwife is the one that's going to be with you throughout, especially if it's private midwives or even independent midwives that open their own practices. The midwife is going to be with you throughout. Even if it takes like 20 hours, as soon as you're admitted, the midwife's going to be there with you. And then the doula, once your labor is in the active phase, the doula is going to be there with you.
Okay. Yeah. So midwives would, if you go to a midwife, would they say, give you a list, like these are doulas that you can approach that I work with?
Yes, yeah. Okay. So in private practice, it's very nice. So I'm also in private practice, and I have my own private practice clinic where I see my own pregnant women. So I do have a sonographer that I work with. The sonographer will do the scans. I do have gynaes that I work with, so that I can send my clients to those gynaes if there are any complications. Yeah. And also just to like maybe 2 visits with the gynae in the pregnancy. And then I also work with doulas. Okay. So the nice thing about private is very nice. Like you get to know people, you work with people, then you're like, okay, I like that person, I like their work ethic, and you know, then you work together. You start referring clients to each other. Yes. Yeah. So yeah.
Okay. So how do medical aids work? Like, are the medical aids that say they only work with gynaes, or can they work with both? Or are the rates the same also?
Yeah. So gynaes charge more. Gynaes are more expensive, obviously, because they are doctors. Your gynaes charge, you can pay anything from, I think, 1.5 to 2,000, but I think it's mostly above 2,000, like 2.8. And I think it also matters whether you're paying cash or medical aid. So some gynaes will charge more when the fee is more on medical aid and less if it's cash. Yeah. So when it comes to the midwife, most midwives charge, and also depending like on the clinic, because there are also like private clinics like Unjani Clinic and what's this other one? Your Alma clinics, and
Genesis is one of them.
Genesis is
I know it
was a maternity clinic, maternity clinic. So
specific, okay.
Yeah. So Genesis, it's like there are private midwives, just like you would find at a private hospital where there are private gynaes that have their own clients that they help to give birth at that specific hospital. Genesis was like that. So there are private midwives who have their private practices, and then they would birth their clients at Genesis. Yeah, so it was something like that. Okay. So midwives will charge anything from maybe between 400 and 600 and 700 thereabout. Whereas with the gynae, you'll pay around 2,000.
I know, I was paying that much.
Yes.
For each appointment.
For each appointment, yeah. So that's the difference in the price with the gynae. And I mean, it's purely because the gynae is a specialist. He's a specialist.
So is it really?
It's not a normal GP. If you go to a normal GP, you pay less. Yeah. But the gynae
is expensive. Yeah.
So with the medical aid part of things, so for example, in my practice, I charge 550 for the first visit and 500 for the next visits. So with medical aid, it depends now. It goes back to that thing that we spoke about, that if you on their network or it's a non-network practitioner. So for example, I am how am I going to say this? So I do take a medical aid, right?
Yeah.
So for example, Discovery, your MedShields, and those I don't know if you're gonna add this part of the specific medical aid, but like I do have a contract with some of them. Not like a contract, but I'm on their list,
Yes,
so that
yes,
I can
yes.
claim from them.
Yes, okay.
Right. But now with medical aid, there's a network provider or non-network provider. Okay. So if you go to the network providers, that's where your medical aid will pay the full amount, no matter how much that person charges.
Yes.
The medical aid has negotiated with that person or the hospital, and the rate is whatever was agreed upon. But then if it's a non-network provider, medical aid will pay 100% of their fee, right?
Okay.
And the medical aid rates are really low. They're really low. So for example, for an antenatal visit, medical aid will pay 180 instead of 500. That's their rate.
Yes.
Yeah. So that's when now you have a co-payment coming in. So we can still claim from the medical aid, but the medical aid will only pay 180.
Yes.
So the rest of the amount, the 320, then you would have to pay it. Okay. So that's the icky thing about it, because now most medical aids, they don't really do contracts with midwives. It's mostly gynaes that they do contracts with. So, but even with the gynaes, you have, well, and it's mostly a hospital thing. It's more of the medical aid has a contract with the hospital.
Yes.
So with the hospital, there won't be any extra payments. But when the provider comes in, because even with the gynaes, now that I actually think about it, I don't think they're the medical aids are contracted with institutions. I think so, unless that person is practicing at a network institution. But I don't think it happens a lot of times, because even with the gynae, if you go with the gynae, for example, the gynaes that I use, there's always like a co-payment involved. There's always a co-payment involved. Even with my gynae that I have, there's a co-payment. Even if you pay that co-payment at the first visit, and then the other visits there's no co-payment, but most of the time there is usually a bit of a co-payment, unless now, like what you did, you upgraded your payment, your plan on the medical aid, so it doesn't restrict you to where you can go, because most people or more people actually are learning about midwives now, and they want midwives too. Because the nice thing about the midwife, because the midwife is skilled in natural births, the midwife is going to do everything that she possibly can to help you birth naturally. Yes, obviously, if there are complications, the midwife will be on the lookout for those and will transfer you to the next level of care when that happens. But I don't know if I should say this, but sometimes gynaes are busy, and
I know what you're gonna say.
Let me not even
I know what you're gonna say.
Yeah, sometimes gynaes are busy and they don't have that patience. Or like they're just dealing with a lot of clients at the same time. And with labor, like it really needs a lot of patience. And with the midwife, because she'll be focused on you only. But the gynae will be having multiple clients, and then you find that the other client needs to give birth and they have a cesarean section, and your labor is just taking too long. So if you really, really want a natural birth, your best bet is a midwife. But there are also gynaes who are pro-natural birth and who really believe that, you know what, we're going to go for a Caesar only if it's like absolutely necessary, you know. And I think I I've worked with the like beautiful gynaes who actually are pro-natural birth. And they give the women really time. And only when it's absolutely necessary, then they go for the Caesar.
So I think sometimes you just have to make your own judgment, because I've heard people say like, I don't understand why this guy is making me have a C-section. Like there's no need, but just still. But then also C-section takes about 20-30 minutes.
And it's finished.
And it's painful, and the charge is like double almost, like compared to natural birth. I've seen that as well.
Yes, it is more expensive. It is more expensive. So in terms of, I would say what I like to advise my moms, if you want, or if you're not on medical aid and you're with a midwife and you're preparing for the event that if there is a complication, I always advise them, have at least a minimum of 50,000 rand.
Okay.
Yeah, because you can have a midwife, especially if you're not on medical aid, because it's more affordable. It's more affordable. The midwife will see you throughout your pregnancy. You will still see a gynae, maybe like twice in your pregnancy, and you will do all the relevant scans. In the case though that there is a complication in labor, right, then you need to be transferred to the hospital. And if you don't want to go to the government hospital, at least have a minimum of 50,000, because that 50,000, it covers the hospital stay, the 3 days hospital stay, and it covers the gynae, it covers the anesthetist, it covers the pediatrician, just for the cesarean section. Yeah, obviously now there'll be other things like blood tests and all of that. But with those, they're negligible. I mean, if you have enough information, you can say, okay, no, I don't want that blood test. I don't see why it's important. Yeah,
because let me just say yes to everything.
Yeah, but that needs someone who knows this kind of thing. Like, for example, if I'm me as a midwife, I go there,
that's not necessary now.
I don't want it, yeah. So especially as a cash paying patient, because now you really need to, because all of these things, they are money.
They are.
And the blood tests, they are money. So, but if like your stay is very simple, you just have the Caesar and you pay, because 30,000 will be for the hospital, then the 20,000 is, but and the prices vary.
I was gonna say, because now my C-sections, I know they were about 90, 100K.
So they vary also, because now you'll find maybe in that 20,000, the gynae maybe charges 16,000.
Yes, that anesthesia.
The anesthesiologist maybe charges 7,000. And then maybe the pediatrician charges 5,000 or 3,000. And that's like a whole team that needs to be there in theater when you give birth. But
I remember seeing the breakdown. I was like, that's why.
It's a lot.
That's why.
It's a lot. But at least if you have 50,000, you're already almost halfway there.
Also, you know, like the gynaes that you say you work with, like you can refer them to a certain gynae and not the one that will charge them double the price. Makes sense.
And then even with the hospital, you can actually go to the hospital and be like, oh, can I have a breakdown of the test? Because then we know the test that will be done. And then you can just go and have a quotation done. I think you can actually go and do that. Have a quotation of all the tests that you might need. Then you can have a bit of an idea. But things don't always go the way that we plan. There might be extra things that you need, and it might be more. But I think at least if you have 50K as a minimum, it's a good starting point.
Okay.
Yeah.
How do you feel about having like a cash practice instead of you claiming? Because I know my gynae, he has that. So
a cash practice or
cash, maybe I'm not using the right term, but you pay cash for every appointment, and then they'll send you the invoice, and then you have to claim for medical aid.
I actually prefer that too.
Yeah, he does that. He's like, I use cash, and I think also if you're gonna go for a C-section, you need to have paid, I don't know, a few weeks, whatever date before the date.
Booking fee.
Yeah, if you don't have medical aid, then he wants like the money. I'm like, this guy is not risking.
So that's the bed booking fee. It's basically to leave your place at the hospital. So that they know that, okay, there's this person, Keneiloe Myoli, she's going to give birth on this date or around this date, because now they'll look at your due date and be able to save space for you. So there is that. How much did you pay for your booking fee?
I don't know. No, the booking fee I didn't pay cash. Medical aid. It was just the monthly and then weekly that you pay cash. And my medical aid did pay most of it. I think there's just 1 or 2 appointments where they didn't pay the full amount, but other than that, they did pay. I think it comes in also with that thing where you say the doctor will charge you, like it's a separate from the hospital. So the hospital, everything was paid. But I did this with the second pregnancy, have 1 or 2 instances where the medical aid now like refused to pay back the full amount. Yeah. And then, I don't know, I think they changed something because the first time they did pay for like full amounts for everything. But the second time it was different.
Yeah, maybe they changed.
Because also with my gynae, they did pay, I think, 100. Okay, let me not use these percentages because they confuse me. Yeah. But they did pay, I think, the full amount or something. But when he increased his prices now, and then the hospital, it was not, I think the hospital, it was a network. Hence I had to now upgrade to that particular or any hospital. Yeah. Okay. I think in your explanations now you're answering some of my questions. So now I'm going to have to browse by very intelligent people. My question was, do midwives prefer vaginal birth over C-sections? But you did say you don't do any.
No, we don't do cesarean sections. I don't know, like midwives are pro-natural birth, right? But you know, there are instances whereby a natural birth is just not possible. It's just not possible. Yeah. But midwives are really pro-natural birth because now we know that some of these things happen where people get a cesarean section when it wasn't really like necessary. Yes.
Do you think you should get a second opinion if something?
I think so. I think so. I actually had a friend of mine who did that. Yeah, she did that. She was with a gynae, and I'm not trying to make gynaes look bad. I hope no one takes this in the wrong way, but I think it's better, even if you have a midwife and something is happening, even if it's a GP, if you feel like you're not really sure, you don't understand what this thing, do get a second opinion.
Okay, I've heard people say like gynaes, for example, they don't want to help people that are far in their pregnancy. So if you need a second opinion, it's better to go to, there's no gynae that will check you, or they will understand if you explain, I just need a second opinion. But if they give you an opinion that's different, does it mean they're going to assist you now because now you're fine in pregnancy? Or do you recommend you go to like a midwife or a GP care, like you said, for that second opinion? But also GPs can also only do so much.
Yeah, it's really tricky because it also depends on what the issue is. If you are still having a low risk pregnancy, you don't have medical conditions and like everything is, because now the midwife cannot be involved if it's complicated cases. Yeah, but if like your pregnancy has been normal throughout and I mean like something like placenta previa, you can go to another gynae or even go to a sonographer and say like, okay, my gynae thinks that I have placenta previa. Are you guys getting the same thing? Sort of. Yeah, but you can't do it everywhere. And now also, I mean, as practitioners, we're really trying to be safe because pregnancy can have complications.
Yeah, and people like suing these days.
Yes. So we're also trying to be safe. It's not really advisable to let me not say advisable, but it's tricky now when you meet someone and they're already far along in their pregnancy.
Yes.
You don't know what was happening throughout this pregnancy.
Because I heard people say, I'm not going to touch you, like, why are you only coming now?
Yeah. So now you might be taking someone who has complications and you literally taking that person on your shoulders. And then they might actually end up having complications that maybe they were there in the pregnancy. You don't even know who was checking them. You can't trust someone that you don't know. They might have missed something, and then if it happens in your care now, because they're already here with you, that's going to be your complication.
Okay, makes sense.
And the lawsuit is going to come to you.
People say the guy was like, I get it.
Yeah, so, yeah.
But is the government now forced to deal with someone like that? Or they're not forced?
So with the guy,
they also have a choice.
In government, you can't really turn. I feel like, I mean, all of us, you can't turn someone, especially if it's an emergency. You cannot turn someone back. If they come, they're already in labor.
Next question. Now I'm skipping some questions. Okay. How can women overcome birth traumas in anticipation for the next sibling? That's not my question, it's someone's question.
Yeah. Oh, guys, it's a very difficult thing to do. Because one thing I believe in, and I really try my best to do, is ensure that all the women that come across me as their midwife, they have positive birth stories or birth experiences. Because, guys, pregnancy is such an intimate thing.
It is.
You will live with that thing forever. Maybe you were looking forward to your baby and everything you planned it to the T, the whole pregnancy and the labor, you imagine it to be this beautiful, out of this world experience. And then it doesn't go that way. And because of someone else that was taking care of you, and it became so traumatic.
Yeah.
It's very hard, something like that, to like change that experience. You can't change the experience in your mind, and you might also not be able to change how you feel about it. So that's a very difficult thing to do. It's very difficult. But obviously some other things we cannot change them, and yeah, there are those practitioners and healthcare providers that are just not doing things the way that they should, especially in terms of how empathetic and sympathetic they are.
True.
Yeah. Unfortunately, there are those kind of people, and it's not right. It's not right. But I think what I can advise women is, if you can try and be positive, keep a positive mindset yourself, and don't allow what another person is doing to sort of like taint your experience. Because now, especially women who are in the public sector, they don't have options to say, hore, okay, and at this place, if someone is terrible, I'm gonna go to the other place. It's a very tricky question. It's a very tricky question. But I also think, as a woman who's going through your pregnancy, try and think about the kind of care provider that you want. And the nice thing about going to private is that you can get to know that person too.
Yeah.
You are also getting to know the midwife or getting to know the gynae. And at some point, if you feel like, I don't like how this person does things. Yes, or then you can literally change.
Okay, yeah, because I know this other YouTuber, she's changed gynaes multiple times. I think with each pregnancy she's gone to a different person, because she's like, after my past experience, I'm not going back.
You can do that. And it's just a sad reality, and it's not right. It's not right, but yeah, I don't know. It does happen. But one thing I think can also help is, don't think your previous experience is going to be the same as your next experience. Because the conditions might be totally different, and you might have like a totally beautiful experience compared to the previous one. So don't allow your previous experience, even with like how your labor and your pregnancy was, don't allow that to affect how you feel about the next one, because the next one might be totally different. Yeah.
Okay, the next question is, can you have natural birth after a C-section? Someone's question.
Yes, you can do a VBAC. But it also depends on what was the indication for the first cesarean section. So let me make an example of something that a lot of people know: fetal distress. So when you are in labor and the baby is not doing so well with the contractions, because the contractions are stressful on mom and stressful on baby, right? Because blood supply to the baby is momentarily cut when there's a contraction. Okay. So, but now if it's normal labor that came spontaneously and the body is doing this naturally, the body knows what to do. And it knows how long to have a contraction before it can compromise baby. Okay. So But now there are certain instances whereby things don't happen the way they should, and baby is not coping well with the contractions. So the baby will have fetal distress, will be in distress, and we can see it from the heart rate. Okay, that's why we'll put you on the machine, track the baby's heart rate, and so there are certain patterns that tell us that this baby's in distress. So something like that has nothing to do with your body and your passage where the baby needs to go out. So certain things like that caused maybe the first Caesar, then you can be able to try out a VBAC. Because it had nothing to do with your body and the passage baby has to go through. But if it was things like, we call it CPD.
I've heard of that.
Yeah, cephalopelvic disproportion. So that's when your pelvis is too small for your baby to pass through. So now that's something that even in the next pregnancy, it'll still be the same because you still have the same pelvis.
Yes, where did I hear that term? On YouTube somewhere. Makes sense. Now I thought anyone can attempt a VBAC.
No,
makes sense. Wow, that's something new.
Yeah.
Okay. And then would you advise VBACs though?
If definitely you want to have a natural birth after you've had a cesarean section, and the indication for the first Caesar had nothing to do with your body being able to birth that baby. Even things like placenta previa, for example. In the next pregnancy, the placenta might implant itself in a place that's ideal.
The second time around.
Yeah. So then you can try. But also now, the time period from your last Caesar to the next birth, that's also an important thing because that scar needs to heal. Because remember, when you go into labor, that scar is under pressure. Your uterus is contracting, it's going back. So there's the risk of uterine rupture. So that means basically the uterus breaking open where there was a scar. And also now there's a lot of things that need to be thought about. There's a lot that comes into play. Now you can't induce, the labor must not be induced if it's a VBAC. It must be spontaneous. Because when you induce, it's synthetic medications that can overstimulate the uterus, and it can now actually cause it to break open at that place. And uterine rupture, it's an emergency. It's very dangerous, both for you and baby. So labor cannot be induced, and you don't want to augment the labor, which is try and make it go faster. Even if it started spontaneously on its own, and then make it go faster. So there's a lot of things that go into play. But a lot of women do have VBACs and birth naturally after a Caesar, especially when all those things are fine.
Okay. Next question is, what made you decide to be a midwife? Is it a financially sustainable career? And how do you survive as a midwife financially?
Okay, so you remind me of the questions, but the first one, why did I decide to be a midwife? So I actually didn't ever think I would be a midwife. I didn't even know what a midwife was.
Lona, I'm learning about these things now, like a few years ago.
So I basically knew that there are nurses and there are doctors. So I wanted to be a doctor. I wanted to do medicine. And I passed well in matric, but I didn't get into medicine. And the thing with medicine is that everyone wants to be a doctor. So the competition is very tight. It's very tight. So I had already prepared myself for that as well. That, what if I don't get into medicine? So my second option was nursing, because I just wanted to be in the health sector, right? But I couldn't do physiotherapy because I was just like, physiotherapists, they help you exercise and help after you've had a stroke, help you walk or you had an injury. So they deal with a lot with the muscles. And
you remember Agnes? She's studying physiotherapy.
Really? Oh, wow. Okay. So that's physio. And then there's occupational therapy. So occupational therapy as well, like if you have things like autism and like they help with rehabilitation. Yeah. I'm not so clued up a lot about OTs, but they help with a lot of rehabilitation. So I thought, but what if I want to go and work at casualty? And I want to see everything that happens there. So I felt like nursing would give me those opportunities to delve into a lot more things. If I want to work at a clinic and have my own consultation room, I can do that. If I want to know, mental health, I can go and work there at the mental hospital with schizophrenic patients and all of that. So nursing was my second choice. It was my second choice. I hadn't thought about the money and like how much do people earn and all of that when I was still, but what motivated me was that I just want to be in the medical field. Yes. And I want to deal with a lot more than be like very specific to something. So then I got accepted into nursing, and then I didn't get accepted into medicine, which was like, but then I studied at VITS. VITS has the GAMP program. It's a graduate entry medical.
And it's difficult
program.
to enter for VITS. It means you did very well.
I guess, yeah. So, I told myself, okay, fine. I'll study nursing. I'll do the 4-year nursing degree. Then with GAMP, the nice thing is that you get into medicine at 4th year level.
I think you also have some bridging thing where you do, I don't know maybe the term, but you do nursing and then you have an option to go into medicine. I don't know what it's called, but I know it has.
I think now I only know it at VITS. I don't know.
It did have.
Yeah.
It did have.
So I wanted to go into GAMP. So which means then I was going to study 4 years nursing, and then because GAMP wants you to have a degree, even if you did chemical engineering or like whatever degree you have, you might be credited for some. You won't be credited. You have to. But I think if it's medical related, you understand things way better than if you came from like accounting,
like me.
I don't know if you can actually go in from. No, I don't think you can even go in. Maybe I must update my knowledge about that. But it helps if you have a science. So it's more of like catered for like a science background. So people who did like Bachelor of Health Sciences, people who did biomedical sciences. So those kind of like degrees. So obviously nursing, if you did physio, if you did occupational therapy, because some of the modules they are similar. So like, because we're all going to do anatomy, we're all going to do physiotherapy. I mean, not physiotherapy, physiology. We're going to do psychology. We're gonna do life like this. It's called APES at VETS, but it's basically sort of like a life sciencey course. It's animal, plant, and whatever. And if you did biomedical science, so there's like a lot of courses that overlap. So we'll all do physics, and we're all gonna do chemistry, but there's levels to it. So hence it will be so much easier for someone who did maybe nursing, for example, because I also know a few people who did nursing and worked as a nurse for some time, and then they were like, okay, no, I'm going to camp, and they are studying to become doctors now. So initially I wanted to do that, but then when I started working, when I was in first year, so now obviously you work at the hospital, right? You work with doctors, you see how they work. And I realized that doctors' working hours, especially when they're junior, they're very hectic. Like they do like interns. When you're an intern, so it's 2 years of being an intern, and then you do community service, which is a bit better, and then you become a medical officer. But when you're an intern, it's crazy. You work like 24-hour shifts. You can even work like 36-hour shifts. So you're at the hospital literally.
You can't have a life.
It's really difficult. And you know, I also know people who are doctors and they're doing internship, and they're just like it's crazy. And now the thing with how I wanted my lifestyle to be, I knew I wanted to have a family.
Yeah, that's the thing.
Yeah, and also because of my spiritual obligations as well, I was like, guys, on weekends I want to be off. So I knew that a doctor's lifestyle would not work for me.
Yes.
So I was just like, okay, you know what, I'll stick with nursing. And also because when I did third year and we started doing midwifery, I found something in nursing that I was like, wow, this is it. I love this. This is what I want to do. And I learned about the midwives at Genesis who have their own practices, and I was like, that's exactly what I want to do. Because then I can control how I work, I can be flexible. So when it comes to the money, so doctors earn more than nurses. Yeah, I think that's like a very well-known fact. So, and also whether you work in the public sector, it's different. So I would say the public sector, if you're just like a normal professional nurse and you don't have a lot of years of experience, but also even if you have years of experience, the public sector, it pays terribly. But yeah, I mean, obviously you can buy a house, you can buy a car, you can. But, and then when you move to the private sector, you get paid even more, right? So yeah, you'll still be able to afford a house and buy a car and all of that. But personally, and this is one thing I don't like about nursing, and even I myself, when I see people wanting to come do nursing, I'm like, are you sure? Guys, the money is no. The money.
For the amount of work that you put in.
For the amount of work. I'm telling you, Keneiloe, what we do, I literally, sometimes I ask myself, whoever came up with nursing salaries? Because, wow, the amount of work that we do. And even as midwives, you will be with this client the whole time they're in labor. The gynae won't even be there. This midwife is the one that's going to be helping you through each and every contraction. And yeah, but that's just the unfortunate thing about the world and how the world works, especially here in South Africa. But overseas, nurses are paid really well. Like overseas, if you're a nurse, it's like, oh wow,
yeah, it's very nice.
Yeah, no, here in South Africa, no. But however, there is a way to work around the financial aspect of things, which is why I've decided I'm gonna open my own practice. Honestly, that's the only way I believe I can stay a nurse or a midwife. Because I feel like I could have literally done anything. I could have literally done anything. And that's why even on my channel, I spoke a bit of like a career shift. I'm in private practice now and I have my own practice. Because now with your own practice, obviously, it depends on how many clients you have. And with the birth, you can charge anything between 12,000 and how much do the other midwives? I think the highest I've seen is like maybe 16,000. Yeah, or 14,000. But I charge 12,000 for my births. So I mean, if you have a lot of pregnant women giving birth at the same time, not at the same time, but like in a month, for example, you can already like see, okay, how much money you can make depending on how many clients you have. And now there's also the monthly visits that they also have to do. And then you can also have a baby clinic as well, where you do immunizations and family planning. So it's a business. Basically, you're running a business, and the more clients you have, the more.
Do you have other staff members that you work with as a midwife besides the SONA and
people will do admin and
yes
no, at the moment no, because I don't see a need. I've recently started my clinic, so I don't see a need to employ another person, but maybe at some point when I feel like, okay, the workload is a lot, and that's when I will get someone to maybe like do the admin for me, do the accounts, things like claiming from medical aid, because that's work.
It is.
Taking calls, taking inquiries, that kind of thing.
And what are the chances of surviving a fourth C-section? Do you know?
I know. I don't know. Where I used to work, I think they would limit it to 3. 3 cesarean sections.
So it depends on the hospital or
and
the
the hospital policy.
Okay.
And also your practitioner.
Yes, okay.
Yeah. But the more cesarean sections you have, the higher the risk for uterine rupture.
Okay.
Yeah. So it's
I
not
saw this other
advisable
lady
to
that had
have
90
unlimited
sections. I saw this other lady
Caesars,
that had 90 sections.
Whew, where is she from? Which country is it?
South Africa.
South Africa.
Yes, that's a shocked.
Wow.
She had two natural births and then 90 sections. So she has 11 kids.
I was gonna ask, like, how many kids does she have?
She had 11. I was so shocked. I was shocked. I saw her on the St. Twins channel. I think she was interviewing some religious church thing.
Yeah.
So she was the presenter, and then they were like, "Can you tell the people how many kids?" Yeah, because she looked really good. Like, can you show them? This is a mother of 11, and then that's when she mentioned the 90s. I'm like, what?
Yeah. So I guess it depends on the hospital policy, and also depends on your practitioner. How many cesarean sections is your practitioner comfortable doing? Yeah. Okay, until they just like,
yeah, I'm not gonna, that's enough now. Or go somewhere else.
Yes, but I think where I used to work in government, I think they were like
I think 3. Government says 3.
Yeah, because I mean, with higher risk, it's more money. In private, things are like more flexible because as long as you have the money to do it. But in government, because the higher, the more cesarean sections you have, the higher the risk. Government is not trying to pay a lot of money.
Yeah, because I think that's why they also like advocate for, for the pain you get on your back. The big one you get to minimize pains during C-section doesn't ever go away. I have a 10-year-old and a 3-year, 8-month-old baby, and the pain has not gone away.
3 years and 8 years.
And 10. She has 3 years and 10.
Okay. So that's the injection, the spinal anesthesia. So sometimes it never goes away. Because my mom, I think my mom with my sister, which is the firstborn, she birthed her naturally. And then I think with my brother, or was it with me, because I'm the lastborn, she had a cesarean section. But some of like the side effects can be like long lasting. Yeah, so like the back pain, chronic back pain. You can have chronic back pain after cesarean section, and even now I think she still has it, but it will be obviously worse when you've maybe been standing for a long time, or
it's cold. Does the cold also affect? Or it's a different pain?
Also with that one.
I have the cold one, but it's not on my back. It's more
on the wound.
Yes.
Yeah, so it's mostly on the wound. So even my granny had a thyroid Caesar, and then even with the thyroid operation, and then with the Caesar, people who have Caesars, even like when the child is like a teenager,
they still
I can still feel when it's going to be cold or whatever.
No, my nanny, she loves Ntaya.
So even
it might not.
So even with things like another thing is sciatic nerve pain, anything that has to do with the spine that can affect your nerves. Yes, that can stay for long, because my mom also had that. And she was like now in her 50s, I think, and she was having this sciatic nerve pain, and so some of them, like the back pain, it for some people will go away, but for others no.
Okay. How can husbands or partners be of help in the delivery room?
Labor is okay. So is that with natural birth or with
let's do natural birth, because I don't know. C-section, they just have to hold your head.
C-section, like that emotional aspect, and taking pictures. But even with natural, you want. I think what I would want, maybe let me talk about what I would want. I definitely want my husband to be holding my hand through everything, like every contraction. And labor is a very much intimate experience and emotional. Like a huge part of it is emotional. Because that pain can be very emotionally taxing. So if you have someone who's there, you need someone there to hold your hand, to go through every contraction.
No matter if you screaming and say, "Oh, you did this."
Yeah, someone is gonna hold your hand, like just a hug, and doing all those exercises, bouncing on the ball with your partner, just hugging you the whole time and helping you
Rubbing your
breathe
back.
throughout the contractions. Yeah, rubbing
I've
your
seen
back.
people do that. I don't
That's
know
very
anything about
important.
natural birth, but I've seen
That
that.
is very
You'll be
important.
jumping on the ball and the husband will be here.
That is very important. Even that's what the doula will be doing. Even the midwife will be there helping you with all of these things as well. So, yeah, I think the emotional part, because obviously now other people cannot go through your pain with you.
Yes.
But emotionally, we really want you to be okay. We want you to be relaxed. A stressed mommy is a mommy where the labor can just be prolonged. So we don't want a stressed, anxious mom.
Okay.
So we need someone there who's going to be encouraging you that you can do this.
Yeah.
Believe in yourself. You can
Yes.
do it. You're
Almost
doing well.
there.
You're
Yeah.
doing really well, holding your hand throughout the whole thing. I would like my husband to take pictures of like everything, because you won't be able to
you'll
go
delete
back.
if you're not happy.
Yeah, you'll delete if you're not happy. But I mean, those moments are so special.
Yeah.
You really want to capture them, even if it's just to keep them for you and your family. It's really a special moment.
Yeah.
Yeah.
Okay. So you allow cameras and stuff?
Yeah, definitely.
Yeah, because I know, like, is it the hospital where I gave birth? I think they have a no camera policy. I think it's written on like that booklet that we get. I've never like asked my guy like, can I? Because I know some people, is he comfortable or not? But I think on the hospital thing it says no cameras.
I think, well, for me,
For you,
I
yeah.
would allow my clients to, But I think one thing that we can be mindful of, especially as like vloggers, YouTubers, and those kind of people, let's be mindful of including other people.
Yes,
that
like you,
would not be comfortable.
Yes, like they would need to ask you first,
Yes,
or whoever is. True.
If you're comfortable appearing.
Now there's that Poppy Act also.
We need to respect other people's privacy.
Yeah.
So maybe you can take videos when you're alone in the room. Or obviously if your practitioner is comfortable with appearing. But don't focus on the other person, but focus on yourself.
Okay, I think I have 2 more questions.
Okay.
Okay, second last question is tips for ladies who are going to give birth naturally, things to remember.
Yeah. There's a lot.
I'm sure this one needs a video.
There's a lot.
A video.
Yeah, and I actually
I
actually did a video about this, but
okay, guys, check out the channel. Yes, summarize.
Let's summarize. I think one thing before anything that I could say is prepare yourself mentally.
Okay.
Prepare yourself mentally. A lot of the labor process, it involves your mental space.
Okay.
And you need to be prepared, because if you're not okay here, you won't be able to go through those contractions.
Yeah.
If you're anxious, it will be difficult for you to go through the labor process and also for it to progress. So keeping a positive mindset about it, telling yourself that these contractions are putting me a step away from my baby, from meeting my baby. And it's only a matter of time before these contractions are over. And one thing about the pain of contractions, once baby is out, the pain is gone.
Unlike us.
Gone like it was never there. So with cesarean section, the pain is after.
Yeah, it's after.
With
it's not during,
natural birth, it's during labor. And with natural birth, within 24 hours after you give birth, you're walking around and there's
and my friend just like what?
Yeah. So there's pain with both of them. There is pain. It's not that the other one is painless. there's pain, because now with the cesarean section you have pain, and it might take about 6 weeks for it to go away, and then with the normal birth the pain comes before.
Okay, yeah.
So mentally prepare yourself. Have people who are going to support you also, and someone that you know, this person will be able to help me through this, because like I've met with moms where they're just like, no, I don't want my husband to be there.
Yeah, you can't take it.
Yeah,
I've heard friends who say, I prefer my mom because I have my husband. I can wait outside.
Because now maybe the husband's going to be too anxious.
Yes.
But there are things like antenatal classes, that can help them and teach them about what to do as well. But sometimes, get someone that you know you can trust, and this person will help you. Because all of us need to be encouraging this one mom.
Not
the midwife, the doula, the support person, all of us, we're encouraging you, we're cheering for you that you can do this, you can do it, Keneiloe. So already and don't listen to other people's experiences and make a conclusion based on that, because people have different experiences. Other people will have traumatic births. It depends maybe on where you gave birth, on who was with you, but it doesn't mean that the next person will have a practitioner that's not empathetic and so you might have a positive experience also, depending on where you went to and who was helping you. So and I think a lot of those kind of bad experiences, they put off a lot of women from giving birth naturally, because they just like, I heard people's traumatizing experiences.
Even me, that's why I didn't even try to.
And you'll find that really you might just have a very nice birth, and you come out feeling like, no guys, this is really possible. Not to try and minimize the pain or anything. It's okay, I've never had it myself, but I can see that it is really painful for from the many moms I've worked with in labor. But some moms actually say, I thought it would be worse than I expected it, because already people are socialized to think that natural birth is like, it is painful, but it might not be as painful as you thought it would be. So there are multiple other things that you can do to prepare yourself for birth. Obviously watch like positive birth vlogs and birth experiences and videos that are going to actually show you that this thing is possible, and you can find those even on Instagram. You can find people who actually show visually their experience and how they were giving birth, and you can actually see that it's possible. And that also helps with preparing your mind. So fill your mind with positive experiences, and then there are like exercises that you can do before labor to just help you when you're in labor to feel a bit more confident, and for your body the body already knows what to do. The body already knows what to do, but like some of the exercises help the labor to progress a bit faster, help the baby to descend down into your pelvis, and but there's a lot. There's really a lot,
guys.
But the mental one is mentally. I think that's more important, because if mentally you're not at a good, you're not even gonna try.
Not even gonna try.
You're not even gonna try.
Okay. Last question: what's the best part of your job?
The best part of my job. The best part about being a midwife really is just being able to witness how strong a woman is. Because when it comes to labor, me as a midwife, I'm not the one doing the job. As the pregnant woman, you are. You are doing everything. I'm just there to, like a police, to see, is everything still going well? Are things still progressing the way they should? And then if there's a problem, I need to identify it and manage it and act. But everything else, as the mom, you are the one who's doing it. So it's a beautiful thing. And to watch couples go through this thing together. And you're just like, wow, man, this is so amazing. and now this baby is born, and you're just like,
Yes.
sure, the miracle of life.
Yes.
So just
Can
being
you
a part of
imagine
that.
just like that moment when the baby comes out.
Yeah. And just to know what it took from this woman to birth that baby. And she did it. And she brought her baby into the world. And you just see how now this baby brings everyone together, and people are crying in the room, and
Yes.
it's so overwhelmingly
Sure, I can
beautiful.
imagine.
Yeah. That's the
Sure.
best part of it. Like, you can just see God's power in action. Yeah, it's beautiful.
Yes.
It's beautiful.
Sure.
And just being part of the families. 'Cause
Yes.
then now you're a part of this
Yeah,
family.
now she comes back again.
Yeah,
and
for the
you're
next
like,
baby.
oh.
And you're just like, wow, I was with this
The
family
person,
throughout
yeah.
the whole thing. Yeah.
In closing, I did say if you have any questions for me, Hlalis, maybe leave them in the comment section. Comment anything really. Have you been to a midwife before?
Yeah.
Is it something that you're considering? Have you learned something from this video? Please don't leave without liking. Share this with your friends and family, the ladies who plan on having kids. Yes, and then where can they find you? Your business, your socials.
Okay, so I'm on Instagram, nurse_Hlalis. TikTok at nurse_Hlalis. I think maybe Keneiloe will put the handles in. Yeah, I'm new on TikTok though.
Okay.
And then my YouTube channel. And then if you have inquiries about my practice or my clinic, you can WhatsApp me on 081-211-1156, or you can email me at nurse.hlalis@gmail.com.
Okay.
But I'm practicing here in Joburg. Obviously. Yeah.
Okay. Alright guys, thank you so much for watching until the very end, and thank you so much for gracing us with your presence and knowledge. I enjoyed it as well. Okay guys, until the next one, bye.
Bye.
We're in trances, going off to different places, different planets. Watch your aura pass me by.